to be an effective measure to flatten the curve of the spread of the virus as it minimizes contact between people. The government now hopes the nighttime curfew that came into force yesterday may just be the country's saving grace as Kenyans continue to ignore calls to avoid crowds and keep their distance. Here's NTV's Eunice Omolo with a breakdown on why it is hard to be done at night.
Governments around the world are seriously and urgently rushing to flatten the curve as coronavirus cases continue to grow. Most countries are advocating for social distancing as a way of minimizing transmission. In Kenya, the government has resorted to enforcing a curfew which was effected Friday.
The curfew has been necessitated by the fact that it has been very difficult to maintain social distancing. A lot of our people who have been infected is as a result of social interactions and from our own observations, usually in the evenings and at night.
The Ministry of Health has also expressed concerns over those violating quarantine. Health officials accuse them of observing quarantine only during the day and flouting it at night, thereby exposing Kenyans to the virus.
A lot of the people who have the potential as carriers of the disease are very young people who also tend to socialize at night.
With minimized movement of people, the ministry says it can easily trace and track all contacts, test and isolate if necessary.
There is not a single estate now in Nairobi that has not been touched with the 28 people that I'm talking about. Your neighbor could very, very easily be positive. And you know, as we start on the mass tests, we are going to get more and more and more.
The Ministry of Health is currently working with what it calls Scenario 3. Here is that scenario. In this scenario, health officials assume that an asymptomatic individual arrived in the country through one of the points of entry undetected. The individual developed signs and symptoms of COVID-19 within the local community before seeking medical attention. The scenario further assumes that the individual interacted with the community members and frontline health workers before diagnosis was made. Currently, Kenya has 38 confirmed cases. In total, the Ministry of Health has identified 1,141 contacts. And to break this down even further, for instance, the one case reported in Malindi was in contact with 122 people, while one case in Siaya has 138 contacts. Back to the scenario. From the over 1,000 possible contacts, 50% are at risk to develop the disease within 14 days. From this, 20% of them progress to severe disease, including pneumonia and respiratory failure, while 5% of those who developed the disease die.
That the over 1,000 contacts we are talking about are also going to be with another 1,000 contacts somewhere along the line. This is how this disease spreads. This is how people in Italy and elsewhere are dying in the thousands per day.
The government appeals to the masses to practice social distancing, which has been promoted as the surest way of cutting down local transmission. The government believes that the curfew will slow down the spread of COVID-19 in the country. Eunice Omolo, NTV, Nairobi.
All right.